do so. Today, welcome viewers and participants. I request you would send, after this I'll hand over the floor to the Professor Anne, and after that, whenever your question comes, probably she will prefer to answer in the last. It is up to her what she wished to. After question answer, in the last, I'll sum it up, etc. So today's topic, as all of you know, current trends in health system, and I welcome all the viewers to do this webinar, and you all know we are most welcome to write back to us so that we can improve. Thank you very much for spending your time, and Rishi and Sachin, who is our technology partner, who has always been like Rishi, running around to put things together. And over to Anne. Thank you very much, Anne.
Thank you so much, Dr. Singh. It is an absolute pleasure to have the chance to spend an hour with you this morning, if you happen to be in a North American time zone, and for an evening if you happen to be in India and larger parts of Europe. It is an incredible honor for us from the World Health Innovation Network. And what I thought I would like to do today is share with the group a very high-level sketch of some of the areas that we are seeing in the health system innovation work we're doing, and have some discussion and dialogue as to where these trends could be opportunities for countries in terms of advancing, accelerating health system innovation to achieve value and quality, but also sustainability in our healthcare systems globally. They become extremely important to support health worldwide. And when you have healthy populations, of course, you have also economically or economic value and growth. And of course, that advances GDP, which makes quality of life better for all of us. So let me start, and I'm hoping you can actually see my slides on the slide 2 really shows and demonstrates the challenge all healthcare systems are facing. That is the increasing costs of health systems. On average, globally, it is increasing 5.3% per year. The very highest percentage of global GDP spend is, of course, in North America. That is driven heavily by the U.S. system, but Canada is a very close second in terms of the rising costs. Europe is also challenged with just over 10.7%. We're consuming greater costs than our GDP in country by country is essentially generating, and that's really a very significant challenge for countries, and to make sure that we have health systems that can deliver the healthcare services needed to keep our populations healthy going forward and over the longer term in terms of sustainability. If you go to slide 3, you will see how that looks a little bit differently in terms of comparing our health expenditures as a percentage of GDP. In the various countries, you will see some countries like the UK have been more successful than others in terms of flatlining the growth in the health expenditures. That has not been the case with our U.S. colleagues, although that is certainly starting to unfold quite well. And Canada is, and some of the European countries are striving to do the same. It is a very significant challenge. Many health systems continue to rely on expensive hospital-based care, and really the drive towards achieving sustainability will require all systems to look at a greater balance of health services being delivered in communities that keep people healthy and well, rather than waiting for them to become quite ill and be ill enough to require hospital care. So it's a question of economics and sustainability going forward in terms of how and where we can achieve sustainable health systems that deliver value to our populations. If you go to slide 4, This gives you a graphic of the aging populations and how rapidly and which countries are going to need to figure out much more effective models of care and services that keep our elderly populations healthy, achieve a quality of life, and do so and maintain independence as much as possible. In the next 35 years, as you can see here, our number of people globally over the age of 65 will almost double. So it's not so much that aging populations drive health system volumes, because there is data that suggests it's not just the age group, it's the age group plus the degree of chronic illness and or prevalence of illness that really imposes demands on health systems. This will require a different type of health services delivery. The people over 65, particularly over 75 and 80, require different types of services and supports in their communities if we are going to be able to manage the volume of care and services that this group is currently requiring. If you go to slide 5, this is a second or perhaps third issue health systems need to be considering. This is Canadian data. However, you can at least project that we're not alone in this one. Chronic diseases rates in Canada, probably North America, are rising very rapidly, 14% per year. Just one issue that Canada faces, not unlike our colleagues in the US, is children's rates of obesity will drive these chronic illness rates very significantly over time. We have the first generation of children in Canada right now who are projected to perhaps not outlive their parents, because those rates of obesity will drive very significant rates of things like diabetes, cardiovascular disease, and hypertension, which we all know puts significant demands for health services on our systems. If you go to slide 6, this is the overall performance ranking that's published annually by Commonwealth Fund. Some of this is also World Bank data. And that really looks at country by country how well are systems doing in terms of the costs and the funds they're putting into our health systems and the quality and performance of those systems. You can see once again the US and Canada are ranked at the bottom of this group. We are all working rather hard in North America to overcome those rankings, and we perhaps have much to learn from countries, once again, like the UK, who are spending far less money per capita and yet are achieving pretty significant and very high overall rankings in terms of quality and performance. One of the areas that I won't speak to today, but I think is a looming challenge we need to be addressing more directly, is patient safety. Many countries are doing quite well overall in some ways in this ranking, but when you look at emerging data from a number of publications in the last year to 2 years, medical error, for example, is now the third leading cause of death in a number of countries, Canada and US being two of those that I can speak to directly. So I think we have significant challenges as health systems move into the next decade or two around, can we offer health care with sustainable models of funding that right now are outpacing our ability of our countries to generate GDP. So particularly with even public versus private systems, this is definitely a trend to consider carefully. If you go to slide 7, these are different trends in terms of what kinds of demands, challenges, expectations are being placed on health systems from the populations we serve. I'll cover very briefly. We have a different consumer than we have often had, and I use the term consumer quite deliberately, although many systems do not. And the empowered consumer, the shift towards wellness, the use of digital tools. The shift between our focus in many years has been single illness. We've used clinical trials as a way to identified best practice. We're really now moving towards how do we manage multi-comorbidities and how do we do so at an affordable, sustainable model. And what are the expectations placed on health systems in terms of accountability and value? So if you go to our next slide, I'm on slide 8. Really, the future health system, as we all move forward, is going to need to consider a different patient or consumer than we have considered or worked with in the last several years or decades, and that is the empowered consumer. Consumers are much more likely now and going forward than ever before that in managing and self-managing their own health. The only question really then becomes how do health systems engage consumers given the opportunity and the tools they have in hand, particularly in the digital space, and I'll touch on that briefly. If you go to slide 9, this gives you a sense of what I mean by a different and a shifting consumer world that we need to think about in healthcare, at least in my opinion. If you think about Uber, it's the world's largest taxi company that owns absolutely no vehicles. It relies on people sharing their vehicles, creating a business or an opportunity out of that. Facebook, similar. World's most popular, or maybe among the largest media owner, and yet it writes or creates no content. The people who subscribe to it create the content, and that's what drives that business. Alibaba, same thing. Most valuable, largest retailer in the world, they own no inventory. Airbnb, largest accommodation provider that owns no real estate. So this is an interesting graphic from the New York Times with Tom Goodwin, who says, something very interesting is happening. Mobilizing consumers and sharing resources and then creating new models of how services are delivered is really a concept I think health systems may not be or may not have considered quite as front and center as we might want to think about in terms of how do we get to sustainable models of healthcare. If you go to the next slide, number 10, many times people will say, well, the growth of those digital markets are really for young people, but there is data coming out of a number of studies that would suggest that's just not the case. 71% of seniors are downloading apps and are accounting for the fastest growing market in the use of digital tools and devices like smartphones and iPads. Of course, when you think about that from a family perspective, seniors have to and want to and are thrilled about connecting with their family members. So if their grandchildren are all online, it would make sense that that's where they need to be in this world right there beside them. It's also an economic driver. Mobile healthcare apps are accounting for a 360% increase in global revenues and are expected to reach a $27 billion level of revenue just in 2016. It's a very rapidly growing market and driving GDP and revenue at very significant levels. If you move to the next slide in number 11 now, we did a brief study here at the Innovation Network around what are people using health apps to achieve. I know, and it's very clear, people are online, but until as health system leaders and providers we understand what is the value of those apps, I think we will really be challenged on understanding how then do we engage this consumer market to help them stay healthy and self-manage, but do so in a way that's evidence-based and they can access the expertise they need from health systems when and where they need it. If you look at the the reasons people are online and using the internet, it is now the case that health information is the third most popular online activity. So the world is generally going online to learn and to understand and to find resources related to their health. I would suggest they may be much less often going online to engage health systems directly. When I did a study of the types of health apps, this was in 2012, there were 97,000 health applications available on the internet just at that time. It is well over 100,000 now, I'm sure. When you look at what do those health apps do that consumers are either downloading for free or using and paying for, they all fell into about 3 categories. One, and the most common one, was a self-help tools around sleep and meditation. The second and third were much more focused on fitness, health activities, health behaviors that help consumers achieve their health goals. So it's very interesting that most of those applications are not helping consumers manage diseases. They're helping consumers manage to stay healthy and to strengthen quality of life. That is quite a different focus than what health services and health systems tend to focus on, but I'll come back to that in just a moment. So if you go to slide 12, just very briefly, there is no question, in addition to having phenomenal access to information online, our society really are increasing on transparent, real-time information at a glance from everywhere. So whether you happen to be traveling in Spain or you are in Australia, working or anywhere in the country, we are very accustomed to real-time information in the palm of our hands, usually with some type of a smart device. We go to slide 13. The exception tends to be in healthcare. So the same consumers that are going online to book travel, they use online banking tools, they even go online for a large number of information around social media, news, or ordering goods for retail. The one sector that has not embraced and engaged that kind of strategy is healthcare. So those same consumers are online seeking health information, but to a large degree our health systems are not as nearly as well developed and connected to the consumers we are serving to work much more collaboratively and closely with them. And that's a very significant global health challenge I think we probably need to address sooner than later. If you go to slide 14, many would suggest that the future of health systems is to get connected in a much more robust way with the populations we serve and focus on how, where we can best achieve value. We use these digital technologies every day to shop, to study, go do our banking, as I mentioned, and travel. We don't achieve that same level of engagement in healthcare. And connecting, I often point out Facebook connected people in the world around them to each other, and health systems really need to think about ways we can do the same. If you go to slide 15, part of that question is how do health systems go about it. Really needs to consider the shifting consumer culture. I've mentioned the shift in terms of the use of digital tools and technologies. There is also generational shifts that are quite distinct and map onto the use of digital tools, I think I've alluded to. When you look at our parents for the older generation, that turning 65 and older, that generation of consumers, many, and this may be a little bit more North American centric, I apologize if it is, but we could perhaps discuss this. That is a generation who are quite different in what they value than our children. Our parents are much more patient. They tend to be very used to waiting. They grew up at a time pre-internet where there was no access to real time. They were all socialized to, you wait to get those phone calls returned, and it's a much different set of expectations our older citizens have for placing or demands for placing on health systems. They're also a generation that value stable relationships. They are much more likely to go to providers that they know and have always known or have had some kind of a connection to in a personal way, regardless of whether they see that provider's expertise or competence or skill sets or whatever it might be. It's much more about that personal relationship unlike their children. They're very loyal to brand. They see health as a service, and they are much more likely, although this is starting to change, to defer to the expertise of the provider. They're more likely to go to that physician or that provider team, ask for their assistance or their input, and that level of expertise becomes very important to them. That is also, excuse me, very much driven by cultural differences across many countries, but by and large, that's a bit of a different group than their children. Their children are, and these are, the millennials and the younger kids coming up. They are not as patient. They have grown up in a world where information is absolutely at their fingertips every minute of every day. We could have a lot of discussion on whether that's good or bad, but it is the reality this generation, younger generation, is living in. They are very connected. They are not so loyal to brand or personal relationships. They are much more loyal to value. If it's highly valuable to them, they will pursue it extremely aggressively in a very focused way, but it's about value, and they are quite happy to walk away if they don't see the value. They see health as their right, not so much as a service that gets delivered, and they are much more likely to go into provider relationships or organizations and do a lot of research first. They seek and look for a lot of data, and they're more likely to negotiate the solution or the outcome with their provider as opposed to simply take their advice. These are all fairly high-level emerging trends in data from marketing, of course, from many other sectors, and to some degree health. But I think these are ideas and things we need to think about. It is never going to be in health systems one size fits all. We really need to be considering much more clearly, in my opinion, what our different health segments in our various populations are really looking for and needing, rather than trying to design that system that achieves the exact same outcome and set of services for an entire population. It is not something that is actually perhaps going to work for each of the segments of the populations we serve. If you go to slide 16, this is just a slide I developed that captures health systems for many years have been focused on achieving system value. The triple aim has been a hallmark of focus for many health systems. I am not suggesting that that's no longer important. It certainly is. But what I am suggesting is that I think we need to be considering or overlaying what's the consumer-focused triple aim. And consumers, when you look at how they seek and acquire services and products, they look for three things. Business schools will often call it the 3 C's. They look for convenience. How do I access it, and how convenient or easy is it to access? The younger generation in particular is far more likely to access things online. Choice is very important, that they have a choice and they see their role as very central in determining the choice that best fits their particular needs. And of course, cost. Not just cost in terms of monetary cost, but cost in terms of, is it something I can leave work to go to access, and in leaving work, does that present additional or different costs to them? So consumer-driven triple aim, or more likely triple value, is perhaps an area health systems need to be addressing in terms of how we look towards creating those sustainable models of healthcare delivery. If you go to slide 17, it really just as briefly brings forward what we've already started to address, and the question being, do health systems today really have a strong fit with where the consumer needs, demands, perspectives, and values are? We tend to, in many health systems, be very focused on disease and diagnosis. We're very good at curative illness areas of service delivery. I'm not sure we are as focused on supporting and driving self-management so that we help people stay well. And for those who have chronic illnesses, we help them self-manage those chronic illnesses so that they have greater sense of autonomy and can achieve quality of life with greater independence. If you go to slide 18, that essentially what I'm getting at, I guess, is suggesting that we are almost going to need to redefine healthcare, not towards moving away from that disease-focused curative and fixing and acute care demand for care, and more towards how do we help and our patients help themselves to achieve what they strive for, which is wellness, prevention, quality of life. If you think for a moment about the apps people are using, they're not looking for so much disease management. They're looking for how do I achieve quality of life. And I think that's where health systems could have a greater focus. If you go to slide 19, just very briefly, this is a classic example of the kinds of patients we are working with and figuring out better or different models of care. This gentleman, we'll use the name Jim, has many chronic illness challenges. He has chronic obstructive lung disease. He's had several strokes. He's taking medication, many medications. He has 8 different health providers visiting him in his home weekly, and he's still going to hospital for admissions because his care, he gets acutely ill very frequently. When we look at these patients who are relying on hospital care primarily, and even those who have this kind of community visiting services, what we really need to help Jim with is not so much can we put 8 providers in his home every day. They were still not achieving health and quality of life for him because he was still requiring multiple admissions to hospital. We really looked at it and worked with Jim carefully, and Jim said, look, the best thing you could do for me is get those 8 providers out of my home. They're driving me crazy. So what we did with Jim was we had just assigned 1 provider that worked with him as a partner very closely. And within a matter of a few days, we were able to and his family so that he no longer needed hospital admissions, no longer needed to go to emergency visits. That 1 provider coordinated all of the different specialist care he was receiving. And he came back to us, he said, I haven't felt this good in 30 years after just working with him for a matter of a couple of weeks to tailor the care plan to what he needed, when he needed it, and not throw so many services at him that were just not achieving value. In slide 20, really, there's a huge focus on patient experience. And my suggestion and thoughts on this are similar. You know, we ask in so many other sectors like healthcare or like travel and banking and hotels and all those things to ask our customers how to rate our services, and that becomes very important data for us in terms of are we achieving what consumers want us to achieve. In healthcare, we don't do that. We tend to, in many settings, ask very specific questions around, you know, would you recommend this hospital to your family, friends? The question is, patient experience, are we providing the type of services that patients really need? And are we using the tools so many other sectors are using online to engage them in helping health systems understand much better what is the experience and the type of services they need to help them stay well rather than how long they had to wait or whether they were able to access a provider. So patient experience is becoming very important. We need to look at how populations define value. They certainly define it anyway in every other sector. It's another area I think health systems could do some more work. When you look at what we measure in terms of our performance, I showed you earlier the OECD performance indicators. They're more system-focused and provider-focused. Health systems measured how, you know, our morbidity, mortality rates. We measure whether people had infections or whether they were readmitted or whether they had adverse events. They're all very important things to measure, but they don't have very much to do with what consumers measure. Consumers measured, have I progressed towards my goals? Have I been able to use those health apps to lose the weight I wanted to, or stop smoking, or be healthier, or manage my chronic illness? That's a way I think health systems could have a better engagement with the populations we serve by identifying whether we are helping and able to work with them to achieve the goals they set for their healthcare rather than goals that providers might set based on best practice or best evidence. So slide 22, just to finish up, is really some solutions that we should be perhaps considering in a healthcare delivery. Is how do healthcare teams and organizations engage with the populations they serve and help them manage their health and wellness, rather than waiting for them to get ill and then just simply manage the acute episodes, which we are very good at, but I think we need to perhaps consider additional ways to think about achieving value. How do we measure value more accurately, not just in terms of how many patients, how many transactions? What are the outcomes our health services are achieving? We tend to focus on, did we deliver, 5,000 cardiac catheterizations or 2,000, whatever the procedure is. The question we need to perhaps be asking more specifically is, what outcome did we achieve for that group of families or patients, and was it what they wanted to achieve, and will that address and focus and support achieving health and wellness more specifically? Accountability and collaboration. Given the multiple chronic comorbidities we are starting to see and the aging population, this will not be solved simply by the hospital sector. It will be the hospital sector working with the community agencies right across the various services and continuum of care to collaborate and work together, rather than working independently in very disease specialization types of silos. The other value I think we need to be considering is, how do we learn from each other? Rather than each country trying to design new ways forward to achieve sustainable, high-performing healthcare, how do we better engage with collaboration across global borders? Dr. Singh, I commend you tremendously for this kind of a forum where you put people on a online tool to start to have those dialogues. I think they will be very important in future. If you go to the next slide, all systems are really trying to solve the same challenges or very similar, hence collaborating and working together is more likely to accelerate our progress, are moving away from our transactional procedure-based focus towards much more population health and wellness. On costs and managing costs and growing demands, I think we've talked about that. The disconnect with consumers and how we achieve much better ways to measure value. I think, go to slide 24. We really need to be looking at thinking about the Formula One racing teams. How do those teams work effectively and win that type of challenge, such as a car race? They work very closely together across very different skill sets of expertise. If you think about how that could be applied to healthcare, bringing wide range of skills and expertise across a number of areas of healthcare together in our communities with greater transparency, I believe will actually drive forward on helping and design and achieve value for the patients we're delivering care to. And just to finish with a brief quote with Buckminster Fuller, who said, "You never change things by fighting the existing reality and trying to just tweak little pieces of it. To change something, you actually have to build a new model that makes the existing model obsolete." And I think that really captures some of the work we need to do in health systems. The work we're doing here at WIN on slide 26 is really building the evidence for how those new innovative models and approaches to care can achieve value. We are a very knowledge-intensive system. It's not something that's just a good idea, let's try it. You have to consider the evidence. So we usually start with an established proof of concept, whether it's a new model of care, a new device that enables a new model of care. We look at how do you achieve proof of relevance and create the evidence for impact. And most importantly, how do you design models for scalability? So what was really successful in one jurisdiction, one country, how do other jurisdictions and countries learn from that, create models of scalability so that many populations can benefit by some of those very important innovative models in health systems. And just to share with everybody, we have our next event for those who may be interested or able. We will be presenting our next body of work focused on how do we create visibility in our health systems, or some would say transparency, or understanding how processes and systems and outcomes are working for patients, what products and performance of those products are achieving value, and how does that help us accelerate a much greater high-performing system that is more cost-effective. So if any of you might find that of interest, I wanted to share that with you. And Dr. Singh and Sachin and all of our colleagues in India, thank you all very, very much, and I'm very happy to spend the rest of our time this morning or this evening, depending on where you are, taking questions and having some good discussion.
Thank you very much, Anne, and I really appreciate that what you have gone through, the slides. And the Sachin, my colleague, has already been tweeting on your slides, so maybe at later you can look at that he has done that. Ladies and gentlemen, there's a three learning I could gather from Anne's deliberations. One is that the patient is very well informed. So people even talk Dr. Google, that he, before goes and visits the doctor, he knows everything more than what doctor, and he question him. Why not this and why not that? Yeah. And the second one, what she said, the cultural one, that is very much there, that there are three kinds of people: X generations, which we are, Y generation, the teenagers, and Z generation, future to come. And their characteristics have been defined very well by the behavior scientists. So she brought that very much, that how parents, children, value, etc. That's a really topic of the day, that how can you really change today's generation and tomorrow's generation? Because today's generation so well informed that they get everything before even they become 6 or 7. They have every kind of information through various things, etc. available. You wanted to really tell you that something that a very young child, 6 to 7 year old, when I get stuck, many times he is a better teacher of mine rather than I can do so
right,
many.
I'm the same way, VK.
And the last one is when he said that so many providers, etc. Really, let's not feel all these Robert to down everything is for helping the patient and not otherwise. So I would always believe, add life to years and do not add years to life. That is what is really, and that's what she conveyed, that 8 providers coming, etc. Now, floor is open for questions, and Anne will be too happy to do that. And after the question answer, I'll close the session.
I have a number of questions on the screen, so thank you so much. One of the questions is really, we have so much data, whether we have electronic medical records, we have digital tools that are mining data, how geo mapping, how is it that with all this data, health systems have not been able to actually engage our populations better than we have? And I think that's a great question. I think health systems tend to be structured in certain ways and perhaps have connectivity within the system. So one area of special, surgeons who work closely with, primary care, that doesn't tend to happen quite as well or as connected as we should. And I think really one of our challenges is how do we much better understand the segments of our population and we personalize our health service delivery rather than assuming, and what perhaps some would suggest in a clinical trial research we've relied on so heavily in health systems. Clinical trials would suggest here's the best practice model for that patient population, and everyone who has that particular illness or challenge gets the best practice care. I'm not seeing that that's actually what is deemed valuable to many sectors of our population. I think we have to design and figure out much better ways to be engaging the different groups within our populations to figure out, is this type of a strategy best for, men or women over 75 versus men or women between 55 and 65. There are so many different nuances, both culturally and from a culture, from a age group, population, demographic, that I think we need to be thinking of. So that's some of the questions. It might take me a lot longer to respond to. So I would throw that out to the group to see what others' thoughts are. I think I'm just sort of reading some of the other questions. Sorry. Is there a business model remotely equivalent for Facebook, Uber, Airbnb, and healthcare? Boy, I would like to find that. So, Sarul Reddy, thanks for that question. It's a great question. I suspect there are, but we haven't documented it yet. If you look at many communities, like my own, what happens is, because they know you're a nurse or your husband might be a physician, they knock on your door. Maybe this happens to you, VK, I'm not sure. I think there's a lot of community models of care that are not captured or engaged with the formal health system. It's simply about people reaching out to family, friends, and neighbors. Have we defined a business model around it? It's starting to look that way. There's a question around Uberization of healthcare. I have seen a number of apps and saying, let's create the Uber version for healthcare. I haven't actually seen, but happy to ask others, perhaps you have in India or other countries, have started to see where consumers or populations or communities are sharing services they can offer each other to help address healthcare. So that I suspect will be starting to unfold. The big question becomes, just like it has in the healthcare apps, is does it connect to the healthcare system? So if I have an Uber device on my phone and I'm getting lots of great service and care for my family member, how does that connect to her, my mother or my sister or my children's physician, so we make sure they're getting the right care, not just what somebody's opinion would suggest? So I think these are really big and important questions, absolutely.
Thank you, and I think you have really taken quite a bit of thing. I would like to tell you that this forum, what we have really created is how we can learn from each other. There are countries which have not, and there are countries which are fully developed. And that is why in the book, the Lord Cripps has said in the book which we had edited, that this is what many of the developed countries have to learn from the developing country. Two of the models actually in India, one is Arvind Eye Hospital, where 1800 OPD and 260 operations a day has been done. How they have brought the lean concept, innovative concepts, and so on. There's Oxford and Harvard has written on that quite a bit. In fact, when I was talking to the people in European Union, they were saying that we want to really copy this model. Well, if you copy this model, then your half of the doctors will be without any job, because that model, so they say, no, we are looking for this model to cut down the cost, because they have finished the appointment system with that crowd, and they have also brought down the cost by 40% less. This is one of the studies which is in Arvind Eye. If anybody is interested, can look up, and there's no. Second one is, of course, Narayan Hridayalaya, the open heart, which they are doing. They have brought down the cost, again by lean concept, by innovative methods, using the technology, where the people are waiting and one after the other the operations are being done, etc. So this is what we are really attempting to, that how can we, people are talking a reverse innovation, frugal innovation, etc. I'm not going to those jargons. But what really in simple form is this kind of format and future forum which we are going to create, and magazine which have already come up where you have contributed. Since the crowd is there, next week we are sending the mass mail to the people. We request, please share your experience. That magazine goes to 25,000 people. And then we can learn from each other's experience, the case studies or anything which you know. It is not a journal, because the British Medical Journal has started a healthcare innovation, and I am the referee on that. Third issue is coming up, but that's a very, very scientific journal. 100-odd people must be reading it, and people like Professor Anne only can write, while innovator can be absolutely person who can even be literate with some common sense. So with this remark, any other thing, Anne, you wanted to convey before we close it up?
No, I think you raise an important point. We are spending a lot of time as an innovation network working across a number of countries, because we are far more likely to achieve impact at the system level if we have much greater collaboration. So if India figures out a much more cost-effective strategy for a particular service or group of patients, and the question isn't how do I take that innovation from India into another country. The question is, how does it get translated and how does it scale? So I think the real big question is here, how do we create the models for translation and scalability that drive this agenda much faster? We are all facing very, very similar challenges. And I had a question just now for a moment around to the degree to which are physicians open to connecting and to engaging in the dialogue. My experience is they absolutely are. The only question is how and where they bring their expertise and their ability to inform the innovation and scalability models, because their demands are so high. But I think the collaboration across sectors and across countries becomes incredibly important, VK. So once again, you're blazing a very important trail globally across countries, that we come together on these forums and these networking opportunities to look at how do we learn from each other and accelerate a much healthier, high-performing set of service deliveries in our respective health systems faster and more effective.
Thank you very much, Professor Anne, Rishi, my colleague Sachin, and all the viewers and the listeners. And any suggestion, you can write a mail to us, you know it. Thank you very much for your kind 1 hour you have devoted with us. We are very grateful. And we are sure you and us, we will do something together to make world slightly better. Lower down the cost and delivery to the places where people are not getting anything. Thank you very much.
Thank you ever so much, VK. Have a